Okay, so the name of the project is called GICMED, and the objective of GICMED is to enable remote screening for breast and cervical cancer at the point of care. And the origin of the solution is almost obvious because these diseases, access to screening and diagnosis for these diseases, especially in rural areas, is a big challenge because of lack of access linked to the scarcity of medical specialists who can screen, and also the unavailability of medical equipment which can be used to do the screening, especially in rural areas. So this creates a big gap, and studies have shown that barely 5% of women currently can get screened because of these challenges. So we decided to bring up, to develop innovative and cost-effective technologies that really adapt to the sub-Saharan African context and can work in rural settings in such a way that every woman, no matter her location or her social status, can get screened and diagnosed in the same community where she lives. So based on that, we've created 5 different technologies under the GICMED project, which are a smart digital microscopy system, smart speculum, simple biopsy device, a telemetry platform, and very recently an e-training platform. And the way these technologies work is that they enable the medical data required by specialists to place this diagnosis to be captured at the point of care by frontline nurses who are trained, then sent to the medical specialists who obviously can be found anywhere in the world. And the specialist can then place the diagnosis remotely, and then the woman can be planned for care accordingly thereafter. Yeah, the technology has been developed solely, in Cameroon by a locally based team of Africans, of course, and that's the pride about it because it reflects also the adaptability of the technology to the context. And so far, we have been able to carry out a series of pilots in Cameroon on all these technologies. The feedback has been very impressive so far because we have been able to bring to light in an evidence-based manner that using adapted technologies, which is what we've developed, can enable women to get screened and diagnosed at the point of care, even in the most remote settings. And an attractive factor about the technologies as well, especially the smartphone, the smart speculum technology, is that it works both like a speculum and a colposcope. And this means it's portable, it's easy to use, and about 100 times cheaper than what is present in developed countries. And this really reflects that its adaptability in the developing context. And following the screening method or the screening process, women get to see their cervix, which better empower them on the screening process as well. It has shown as well to be an attractive factor towards screening also. So the first thing is that we are targeting a problem which is not just particular to Cameroon, but it's a general problem shared by many sub-Saharan or all sub-Saharan African countries. And the solutions have been proven to be able to work well and adapt in rural settings. The bigger picture means that if we scale this solution to every rural area, to every community, to every village, it means every woman living in these communities, especially in rural settings, can have access to breast and cervical cancer screening and diagnosis. And with this system, we can early detect all cancer lesions, treat them early as well. And we believe this is the ideal solution that is going to enable cancer cases to be detected early, treated early, and significantly reduce the amount of deaths and advanced diseases linked to these cancers. This we think is the right solution and the right direction to use to create an impact and really enabling a cancer-free world. By training, I'm a medical doctor. I'm of course a technology enthusiast, and falling across breast and cervical cancer comes from my experience as a frontline medical practitioner in rural communities in Cameroon. And I had to witness firsthand the challenges women in these communities have in accessing specialized healthcare, such as breast and cervical cancer care. This, I would say, is really the motivating factor behind this, because creating a solution that can be scaled everywhere so that every woman can have access became the challenge, and it's really what we are proving to work on now. So building a solution like this is very difficult, and especially developing based in a developing setting, developing country, right? So the first thing is creating the right network that is going to help us to mature the technologies and put in place the right framework so that we can easily scale from one area to another. They can involve partnerships with big organizations that are already working on the field so that we can leverage on their networks to take it to other places. It can involve partnerships that is going to help us to be able to manufacture our technologies in mass, in high scale, so that we can easily diffuse. It can involve partnerships that is going to fund so that we can upgrade our technologies and take to the next level, and also bring in the next ideas we have as well, which integrates things like artificial intelligence.